Well, today was supposed to be another day of mediation between Northern Light Health and Anthem Insurance as they try to come to an agreement on reimbursement rates.
Last night, the two parties announced publicly those efforts have fallen apart once again. News Center Maine's Christian Harsa has more on the situation and what it could mean for patients.
In less than a week on October 1st, the primary care providers and specialists at Northern Light Health facilities will be out of network for about 30,000 Mainers. Now, this does not mean that Anthem customers cannot go to Northern Light for care, but it may cost them more.
It really depends on their individual plan. Some individuals may have no coverage for out-of-network providers.
Senior Director at the National Academy for State Health Policy, Maureen Hensley-Quinn, says changing insurance to access those providers in network isn't likely possible until January 1st.
The options really are looking for a new primary care that is in their network.
Which President of Anthem in Maine, Denise McDonough, says is there.
There is capacity out there in most regions of the state.
Hensley-Quinn says transitioning 30,000 patients wouldn't be easy.
But unfortunately, it's going to be, it'll be a hard thing to do.
Northern Light and Anthem are again at odds over contract language. A spokesperson for the hospital writing to News Center Maine, "We were available today and remain available for the other dates identified for mediation to meet with Anthem if they responded to our contractual language requests." Anthem says those requests are unreasonable.
Because they're not stating that they would only do so if we had agreed to their satisfaction on all of the demands that they had made.
McDonough says Northern Light will stay in network for patients needing continuing care like pregnancy or cancer treatment. She says for others, Anthem will help with the transition.
But we will assist them in any transition that is required if we are unsuccessful, even if it's for just a short period of time.
According to the Maine Bureau of Insurance, Maine state law requires health plans to provide reasonable access to care. So if a patient has care that falls outside of network, law requires that Anthem will provide it at no extra cost. In Portland, Christian Harsa, News Center, Maine.
A Northern Light spokesperson says the system is still open to resuming negotiations next week. Whether or not Northern Light and Anthem can come to a deal, emergency care provided by Northern Light to Anthem customers will remain in network per federal rules.